I decided to have a career in biotech. I was actually at Mount Holyoke doing my undergraduate work, thinking that I was going to go to medical school and become a doctor. That was really what seemed to make sense. It was what most biology students would go and do. And neuroscience, which is what I ended up doing in my undergraduate, was a little more specialized and nuanced than that, but also was a pre-med track, they call it, which means you're about to go to medical school. So I was preparing to do that when I ended up meeting a friend's father, who was the CEO of a biotech company here in the Boston area. I met him at dinner at their home. I'd gone home for a weekend with her and heard what he was doing at his company and was so inspired he offered me an internship after my junior year in college. And so I spent the summer working there and decided the concept of helping huge groups of people as opposed to one-on-one as a doctor really spoke to me. The idea that I could actually help develop a drug that could affect, at the time the work we were doing was in Parkinson's, that you could actually build something that would help hundreds, thousands, more than that, potentially, depending on what therapeutic area you're in. That was inspiring to me. And so I really wanted to pursue that. I ended up taking a job with that very company right out of college. And I worked in the labs initially, doing work both at the bench, but also in the animal labs, and really enjoyed that work until I became allergic to the animals we worked with. And so I couldn't do the work that I was enjoying doing. And they switched me into what was called the clinical department to try my hand at the sort of next level of work that happened. Once you finished animal work and you went through work with the FDA, you could go into patients who had disease and treat those patients. And I was able to take the work we had done in animals for stroke, animals that had had strokes, and apply that to a program that was being taken forward in people who had strokes. And I watched the very first surgery where we put cells into the brain of a patient with a stroke, and I watched her then go from being wheelchair-bound to running a marathon, and I was hooked. I was never going to leave, and it was exactly where I found my passion in those moments. And once you find that, it's so easy to pursue it. It makes everything so much easier.